Joining me now to talk about this is Dr. Susanna Hills, pediatric surgeon at Columbia University Medical Center. Dr. Hills, thanks so much. I know you're going to provide perfect clarity that hasn't existed for the better part of 2 years on this issue, but I think, and Paula's piece really gets to this, but we've all been dealing with it. You know, across the country, you have local mask mandates, they're going away. On a national level, the guidance obviously hasn't changed. What advice do you give patients, or would you give someone in an area with high community transmission but no mandate on masking right now?
Yeah, well, no matter what I think, right, this is happening. You hit the nail on the head right there by talking about what the local transmission rate is. That's the key. People need to really look at what their local rates of infection are, what their local rates of positive tests are, in combination with what their local vaccination rate is. It is different for somebody living, for example, in Alabama, where the positive test rate is above 30% right now. Vaccination rates just barely hovering at 50% versus another state where infection rates, positive test rates like New York, New Jersey are approaching 5%, lower than 10%, with vaccination rates above 70% or so. So it matters where you are. And if you're in an area with a high transmission rate, low vaccination rate, then it's just really important to pay attention to the vaccination status of those around your kids, to consider masking kids if they're indoors, if they're in classrooms, to just really be aware of what is happening with infection rates around you, and to do all of those protective measures if the infection rates are high. If infection rates are lower, then I think it's not unreasonable to move toward loosening some of these restrictions, because we have to start living in a world where we are comfortable ramping up protections when we need them, and where we have an off-ramp when infection rates and cases are lower.
There's two interesting things in there that I kind of want to dig into. One is, you know, this isn't a monolithic moment, right? Communities are different, localities are different, states are different right now. But it's also a moment where I think the population is very ready to move on. People are very tired of everything, despite the fact more than 2,000 people are dying on a daily basis at this point. But it gets to the kind of political / exhaustion question of, is it time for the CDC, which isn't responsible for just their locality, it's responsible for guidance for the entire country, to shift that guidance maybe to reflect where people may be more broadly?
Absolutely. And people need to plan for the next steps. I think a huge part of the issue is not having a next step. And I think across the country, case rates are still high enough. Positivity rates, even in the best areas, still are above 5%. We really want them lower than 5% to feel comfortable. But within the next couple of weeks, you know, case numbers have been dropping so precipitously. By the end of the month, early March, a lot of places will be very ready to have much more liberal freedom in not masking, in releasing some of these protections. And so the CDC really does need to give that next step to people so they understand what should they be looking for, what is the CDC recommending people pay attention to know when it's safe, and when might we move forward from this. We've got to have a next step. I think we're getting there because case rates have been dropping so much. And really people are looking to the CDC, or have been, to provide the next step. And if the CDC isn't going to give it, then they are going to look, as they probably should, to their local and regional governments.
When it comes to kids, look, I've got 3 young kids. I live in a perpetual state of confusion and reading guidelines in different schools that generally I don't understand. You talk about the next step. What's your view right now in terms of kids, masks, classrooms, and what should happen?
Yeah, again, like we were just saying, it does depend somewhat on where you are and what the case rates are in your local area, what the vaccination rates are. But if you're in an area that is relatively well protected, your district or your school has a reasonable vaccination rate, your case rates are coming down, then yes, districts, I think, can move forward with releasing these mask mandates and going without in the coming weeks. I strongly urge parents, families who are in areas of high case numbers who haven't gotten their eligible kids vaccinated to go ahead and get them vaccinated. That is another really important step families can take to feel comfortable releasing some of these mask mandates, giving their kids more freedom. We have a lot of work to do in that area. Our 5 to 11-year-olds are still only at about 23% in terms of vaccination rates across the country. And our 12 to 17-year-olds, just above 15% of those kids are vaccinated. So we have a lot of room where we can work on getting kids vaccinated that will help them be safer without masks in schools as well.
Yeah, no, the tools exist. I think if there's one thing that's so clear about this moment compared to the last 2 years, the tools exist. Dr. Susanna Hills, really appreciate your time and perspective. Thanks so much.
Yeah, thanks so much, Phil.